How do you get AIDS? Well, let me tell you, it is very, very hard. As you can see by these types of things, you would need to put yourself at risk for doing something that would cause you to transfer the HIV virus through semen, vaginal fluids, or blood. You are at risk by many different things, as you can see by this slide. But remember, sex only once without a condom puts you at risk. Simple contact does not put you at risk. So you could hug somebody, you could drink out of a straw, share a spoon, and you would not be at risk. The only thing would be maybe deep mouth kissing if both of you had a sore in your mouth and one of you was HIV positive. Our body functions by having very healthy helper T cells. As you can see on the top slide, many of us could get the flu or we could fight it off. But if we have a healthy immune system with our helper T cells above 200, then if we are subjected to pneumocystic carni pneumonia or Kaposi sarcoma, we are going to fight it off. It's only when we have become HIV positive and our immune system has been compromised and our helper T cell count is less than 200 that those two killer diseases will invade our body. As you can see here, there's a progression of HIV. You become infected and then you become asymptomatic. In other words, those symptoms of the flu go away, but yet you continue to carry the ability to pass on HIV. You just have no outward symptoms. And then towards the end, you become symptomatic again. You may again have flu-like symptoms, but you would basically be HIV positive instead of just having the flu. And that's when you would then develop into full-blown AIDS and have those problems that would eventually kill you. Fatigue, night sweats, persistent fever, swollen lymph nodes, diarrhea, and weight loss. Because then those opportunistic diseases such as the pneumocystic carni pneumonia, Kaposi sarcoma, toxoplasmosis of the brain, infection of parasites, herpes simplex with chronic ulcers, and literally your body just wastes away. Testing can be confidential or anonymous. Confidential, you go into a testing center and they know who you are, they just don't tell anybody. Anonymous, you go and get tested and then you just call in anonymously to get the results. I feel it would be better to have confidential testing where you would go in, get the results in person. That way, if you are HIV positive, you can get the counseling that you need, the help that you need, the advice that you need. A negative antibody test means you are not infected, or you could have recently been infected. And what you need to do here, once you get tested, then you need to wait. And in the meantime, do not have any risky behavior, and then be tested again 6 months later to know that you truly are not infected. And a positive antibody test means you are infected, you will always have HIV, and you always can infect others. And the tests are 99% accurate.